You're listening to the Abdominal Acupuncture Podcast with Dave Shipsey and Pia Kolonberg.
Hi, Dave.
Hey, Pia. How are you doing?
I'm very well. How about you?
I'm good. I'm excited to talk to you about this great topic you decided on. Hay fever, allergy, asthma type stuff.
Yeah, because I'm one of them. And at the moment, I'm actually still feeling okay, but it's April. So the sneezing, coughing, eye rubbing season is going to start.
Yeah. Well, I'm also blessed with having asthma. So it's one of those. It can be a difficult thing to treat when the immune system is involved, but I think I've done a bit of work on using abdominal acupuncture to treat allergies, stuff like that, and I combine it with other techniques. So maybe we can talk about the whole.
Yeah, that would be very good, because I have to admit, because I'm one of the sufferers, it's probably I lack a little bit of professional distance, so I am not really successful yet treating hay fever or asthma cases. So I would be more than happy to listen to your wisdom, what you can share with us.
Well, and you can contribute with the kind of herbal side of things, but I suppose it's like a multi-pronged approach to dealing with it. Like these allergies are usually due to pollens, dust mite, animal dander, or people have different things that they might be susceptible to.
Yes, exactly.
So often there's a bit of avoidance that needs to be done. I'm sure you're well aware on days where the pollen count is high. You want to close the windows. You want to wear glasses to protect you from getting pollen into your eyes.
You don't cut the grass outside.
Don't cut the grass, and actually don't hang your washing out on days when there's high pollen.
Yeah, that's true. A lot of wind, because you just bring it inside. Yeah.
And even stuff like wash or rinse your hair before you go to bed at night, because that's often going to aggravate your symptoms during the night, because your hair will trap pollen.
Yeah. Or even change the pillow cover on a regularly basis, because that already helps a lot. You're right. You're completely right.
Absolutely.
And you said to me that you wrote an article about that subject.
I did actually. I'm just kind of finishing it off, so I will post that up on our site as well. So I suppose from an abdominal acupuncture point of view, and because I suppose a lot of the causative factors from a Chinese perspective would be due to kidney deficiency for the asthma side of things, and respiratory problems. Spleen, of course, with the dampness and the phlegm.
Yeah.
Then wind and heat or cold can be contributors. So, looking from an abdominal point of view, I would often combine it with other systems, such as even to just open up with using lung 7 on a male. It would be lung 7 on the left, and kidney 6 on the right.
Mm-hmm.
And female, obviously, it's the other way.
The opposite. Yeah, the opposite, the right. Yeah.
Women are always right, as you know too well.
Yes.
So use the right side.
Yeah. So the Chinese now are knowing that for centuries already.
Yeah, absolutely. So, and then I would definitely use bringing chi home With stomach 25 will harmonize the 3 JAWs, or the 3 burners, and also stomach 25 will clear any of the causative factors such as heat or wind or dampness out through the large intestine. And then the abdominal 4 gates, stomach 24 and stomach 26, is a great way.
Sorry, no, I didn't want to interrupt. It's a great way.
It's a great way of regulating the immune system as well.
What about spleen 15? Would you use that?
Could do if there's more dampness involved, yeah. Or you could just use the AB1 point on the left, elbow point on the left to regulate the spleen.
Okay.
Also, I would often use kidney 13, especially for those suffering with asthma and where it's more related to the kidneys.
Yeah, because this is really the kind of strong combination of nourishing kidney.
Yeah, and to assist the kidney function of helping the lungs to draw the chi downwards, so inhaling. I would also, if you're looking at the back quad, the knee point, AB4 on the left, is that's good for lung problems. So I would include that. So I suppose the main prescription I would use would be the bringing chi home with, if necessary, kidney 13, and with the stomach 24, 25, and 26. If there's a lot of dampness involved, I would use either spleen 15 or AB1 on the left to address the spleen chi. And for lung function, definitely AB4 on the right to work at a deep level on the lungs. If there's, obviously with hay fever, you're going to have and rhinitis, you're going to have the sinus involved, and so I would, all those points that I've mentioned, I would go deeper with, as in 0.5 sun to even 0.75 or even deeper on larger people. And then I would also use that wonderful sinus point, which is about 0.2 sun inferior and medial to stomach 24. So if you think it's stomach,
which is kind of related to lung 1, is that the point you're?
That's the one. That's
the one. Okay.
Yeah. So that one. Needling that obviously is going to be more superficial. You're looking at about 0.2, 0.3 sun.
Okay.
And what else would I use? Oh yeah,
the stuff. If the nose is clogged and everything, you would go to ashy points around the nose. Above
around
12,
just above. Yeah. And then I was thinking, like, if there's a lot of eye irritation, burning, streaming eyes, whatever it is, you could use those extra special little eye points that I learned from Dr. Hahn. Now you could use the Ashi points up around 12, but I would definitely use these points, which are, they're 1 sun lateral to Ren 7.
1 sun lateral to Ren 7.
Ren 7, yeah.
Ah, that's good to know.
I didn't give you that one before, did I?
No, I didn't. Does that work also eye infections and things like that in general?
Sure, yeah.
Ah, brilliant.
It's a the special extra points for eye conditions.
Okay.
And on those ones, I'd probably go to about 0.5 sun. So all the other ASHI points and the lung 1 points will be more superficial, 0.2, 0.3 sun. And what else would I use? I would, at this stage of the year, I'd probably use something like Dr. Tan Global Balance.
I'm a novice. I have no knowledge about Dr. Tan. They're still on my list.
Well, a simple approach would be in around, you're using elbow points.
Okay.
Because that'll address elbow and knee points. That kind of refers to the sinus type area. And usually you just palpate, just feel. So you're going to be using large intestine. So Tai Yin, Yang Ming. So large intestine, lung, spleen, and stomach. So
around wrist and elbows, you said?
Around knees and elbows, yeah.
Knees and elbows, sorry. Yeah. I thought you said wrist. Knees and elbows, okay.
Yeah, so you'd be using in around between LI11 and LI10, and you just press for a tender point. When you find that, needle that, then you'd use lung 5-ish, and like moving down from lung 5 towards lung 6. Again, look for a tender spot, needle that. On the knee, then it would be spleen 9 type area. Again, you're looking for a tender spot. And on the other side, stomach 20. Or stomach 36, 35, 36 area.
6. Okay. But spleen 9, especially in hay fever with dampness, would be anyway tender. Wouldn't you say so?
Yeah, and that's going to help to clear the dampness as well.
Yeah.
Oh, and actually, I would always encourage clients to breathe through their nose, which can be difficult, obviously, with hay fever if you're blocked up, but it's really important because you're filtering the air through your nose, so you're stopping the allergens. If you're opening your mouth, breathing through your mouth, you're just getting them allergens straight into your lungs.
Yeah, and it is actually a bad habit that you start doing, because you have moments where you can't breathe through your nose. So I'm observing myself quite often thinking, why do I have my mouth open? I don't need that. I can breathe properly through my nose. So it's a kind of training. You should observe yourself.
Sure. Yeah. Yeah. And that's it. I mean, really, there's a certain amount of maintenance that you need to do to give yourself the best chance of avoiding the triggers that cause your hay fever or allergies.
Avoiding the moments when the pollens are flying around that you are not really hanging or washing outside and things like that.
Absolutely. And like a lot of them are simple, kind of logical things. I mean, another one would be even to put a little bit of Vaseline around the end of your nose so that it'll help to even trap more.
It's kind of like the fly paper.
Sure, yeah.
Yeah, it has a little bit that effect. And as you mentioned, we talked before about it, having a shower in the evening, washing your hair in the evening would be miles better.
Yeah.
To not carry everything into your bed.
And actually, on days of high pollen, I know when I was over with you in France, we had a couple of good thunderstorms. But when there's that kind of heaviness in the air, that kind of electric, thundery feel to the air, definitely don't hang out washing, because that actually splits the pollens into much more small little atomical particles or whatever. So don't hang out washing at that time. And I hate to encourage using drying machines, but sometimes you got to use them, clothes dryers, when the pollen is high.
Or you hang it inside, because I haven't got a dryer, so I just hang the washing inside. That's the less
ideal kind of way. But
yeah.
I was going to say, I mean, if you start treatments twice a week around this time of the year, and advise your clients on the avoidance techniques, as we've just talked about, on correcting your breathing through your nose, they'll definitely be less symptomatic. And with the acupuncture, their immune system and the internal causative factors can be improved so that the symptoms will be a lot less.
Yeah, I agree. I think that's really, it's self-observation and some kind of adjustment, as you said, helps a lot. And then year after year, that could be getting less and less.
Exactly. And the patent herbs or herbs, I don't know.
I am not really good with that, I have to admit as well.
Okay.
I'm more the massage and tuna person than the herb person, but depending on sometimes the symptoms. Because some people are getting really ill, they even get fever and things like that, and then I'll adjust it as it comes along.
I suppose if there's fever or anything like that, then you could use points like do 14, which is on the abdomen is just below Ren 10, and again that would be less deep than the other. You'd be looking at about 0.3 or 4 sun.
What about, just out of curiosity, because I remember lessons years and years ago where the back shoe points were very, very talked to, everything like the lung shoe points and everything. Because in the abdominal acupuncture, the kidney channel is actually also the bladder channel.
Exactly, yeah.
So if you are using points on the kidney channel, you are actually using also like you would use it on your back. So that could be helpful as well. Yeah,
totally. Between Ren 9 and Ren 10, up more towards Ren 10, you'd obviously be able to address using like urinary bladder 11, 12 and 13.
12 and 13, yeah. You might feel it even as a kind of knot.
Yeah, absolutely.
So that would be interesting to find out. I haven't had yet any hay fever patients, but it's not going to wait. I guess it's going to come soon, because I'm looking just out of my window. I can see the lilac fully flowering. So
oh, lovely, yeah.
I guess so from next week on or so I will have people telling me nose clogged up. Yeah,
it's a difficult one, but the abdominal, because as well, when you think like the 70% of the immune system is located in the intestines, so using abdominal should be able to regulate that, and of course strengthen the spleen, strengthen the kidneys, clear the heat, clear the damp. It's all good. But yeah, your patients need to look at what their exposure is. So it's a bit of self-maintenance and a lot of acupuncture and nurturing.
Yeah, okay. So that's quite interesting. So we're waiting with impatience for your article that you will post, I guess, on the Facebook page.
I will have that done in the next day or so.
Oh yeah, brilliant.
I'm doing house study for the next 2 days. So, I'll have it done in the next day.
Oh, no pressure, Dave. No pressure.
You're always pressurizing me. So when are you bring me over to France again?
Well, you can come whenever you want to. The weather at the moment is not really nice, but the workshop, my students are actually all stressing because they have their exam ends of June. So at the moment, it's not the best moment to talk about more studies. But I guess autumn will be, because then the stress, summer holiday will be over, and the brain will be ready to absorb more knowledge. So I will be more than happy to see you maybe in September.
Oh, right. I'll book my flights now.
Okay, have a look already.
Excellent.
Okay, thanks very much for that podcast.
Oh, dear. Good talking to you again.
You've been listening to the Abdominal Acupuncture Podcast with Dave Shipsey and Pia Klumberg, where you learned tips, tricks and techniques to master the art of abdominal acupuncture.